Welcome to Nurse Life Happens. On this channel, we talk about nursing, DIYs, and daily life. Please don't forget to like, share, and subscribe. And I hope the information shared on this channel is beneficial and help you grow in your life and career. My name is Latoya, and I've been bold since birth and fiercely loyal. So let's go ahead and rise and grind. Our topic today is Becoming a Nurse 101, the different levels of a nursing career. I hope this information is beneficial and helps guide you through choosing the right path for your nursing career. So let's go ahead and get into it. Hi, welcome back to Nurse Life Happens. Today, we're going to be talking about nursing, and we're going to be talking about Becoming a Nurse 101. We're going to talk about the different levels of nursing, what programs you need to complete it, what your job description will be, what your income will be, and how and where you would work. Okay? So, Becoming a Nurse 101, what the different levels are. There are 3 levels: non-degree level, degree level, and advanced degree level. So, a non-degree level nurse is a CNA. Well, she's not a nurse, but she's a nurse assistant. So, non-degree level is a CNA or PCT tech and an LPN. Those are certificate level of nursing. Okay? A degree level of nursing is achieved in a community college or university, and that is associate degree RN or a bachelor's degree in nursing. Okay? When it comes to associate degree and registered nurse, there's 3 options of degrees you can pursue. There's associate degree in nursing, which is an ADN. You can pursue an associate of applied science in nursing, which is an AASN. You can achieve an associate of science in nursing, which is an ASN. So those 3 programs you can complete and become a registered nurse. And of course, you can do a bachelor's of nursing to achieve your BSN. After you achieve those degrees, if you choose to, you can go on to an advanced degree program, which is a master's of nursing or a doctorate of nursing. Now, you have the option to become a MSN, get your master's degree in nursing. Then the other options are in master's is you can get a master's degree with a specialty, okay, and that will afford you become a PRN, an advanced practicing nurse, or a nurse practitioner. Okay, so master's degree, you can receive just a master's degree, or you can receive a master's degree with a specialty, which then leads to your APRN or NP, a nurse practitioner. After you've achieved those, you can go a little further and get your DPN. You can go and get your DNP, which is your doctorate of nursing degree. Okay, so you can go ahead and get your doctorate in nursing once you've achieved those. So let's get down to the nitty gritty. But so the nitty gritty of this is the non-degree. So let's start back at non-degree. So non-degree certificate program for a CNA or a PCT tech. I would say PCT tech was a patient care technician. So a PC tech can range in schooling from 3 weeks to 12 weeks. Okay? So from 3 to 12 weeks, it will take you to become a PCT tech or a CNA. The difference between a CNA, you might be thinking, what's the difference? Difference between a CNA and PCT tech is that a PCT tech also needs to be phlebotomy certified, okay? Because in the hospital, you will be working as a PCT tech. You will also not only be taking vitals and giving care, you'll be drawing blood. So let's go back to the basics for this group. As a CNA, you'll be taking vitals, you will be giving care, and giving care requires bathing your patient, dressing your patient, combing their hair, making their bed, cleaning up in their room, um, feeding them if they're unable to feed themselves. So those are the things you'll be doing as a CNA, and a PCT tech, depends on where you work. So CNAs tend to work in nursing facilities. They sometimes do private home care. They have a wide range of where they work. For the title PCT tech, not that you cannot work in these environments, which you can, but PCT tech title is given in the hospitals. So some hospitals no longer take CNAs, they take PCT tech, which means that you are phlebotomy certified, because it depends on the floor that you're working on. Not only do you have to take vitals, you have to draw blood. Okay? Now, the average income for a CNA or PCT tech across the United States is $14.25 an hour, which gives you $29,640 a year. Okay, that is the average. Depends on your state you work in, you can receive a higher pay rate. Okay, and based on your experience, also gives you a higher pay rate. What you need to become a CNA or PCT tech, you need a high school diploma. So you need a high school diploma or a GED. So for people coming from different countries, as long as they have a high school diploma or a GED from their country, they can become a CNA or PCT tech. All right. Once you become and you've completed your 3 to 12 week program, you are certified, but you're not yet ready to work. So you also need to go to your state and complete the state exam to get your certificate to be able to accomplish this job. All right. Now, the next position is an LPN. As a LPN, it requires you to have a high school diploma also, or a GED. Most LPN programs are done in a technical school setting, or private setting. So there's programs out there that are private, and you can achieve your LPN program there. The average LPN program range in time from a year and a half to 2 years, depends on where you go. Okay, the rules are changing for LPN. So LPN, a year and a half to 2 years. When I did my LPN, it was a year, and in the middle of my program, they extended it in my state to a year and a half. So we did our LPN program in a year and a half. I did a year and a half in the program. And some programs are longer. I did it on a technical school side, which cost me $15,000 to do my LPN. My sister did it on the private side, which cost her $42,000 to get her LPN license. Once you've completed these programs, you need to then go and take the NCLEX for LPN. So you will have to take an NCLEX exam to become an NPN, which is a state boards. So you take the NCLEX for PN, and you have to pass it just like a RN would. Okay? Once you become an LPN, your job would be to give medication, catheterize a patient, maintain IVs, and wound care, and many, many more things. Depends on where you work. Now, you cannot start an IV, so you are not going to be putting IVs into the hand where you use an IV needle and inserting it in a vein. You cannot do that. You are working under a RN as an LPN. So the RN would initiate the IV, and your job as an LPN is to maintain the IV line and make sure it doesn't get infected, doesn't get infiltrated, and the RN would initiate the first medicine, the first starting off the IV. So if it's normal saline, they're the first one to hang it, and then if that normal saline finished, you can hang the next one. But the nurse must hang the first one, okay? And you maintain that IV situation for that patient. The average salary for an LPN, this is the average salary. So it depends on where you live. It could be more or less, they're saying, because this is the average. This is the from A to Z, you're in the middle, okay? So this is the average pay. And the average pay is $22.83 an hour, which is $47,480 a year. I can honestly say, as an LPN in Connecticut, I did not work that little. My first LPN job paid me $26 an hour. That's for me, okay? Not saying everyone in Connecticut started that way, but that is for me. Now, the next level of your education is becoming a RN. As a RN requires you to have a high school diploma and a GAD. Now, the average RN program range from 3 to 4 years, and you're only receiving your RN in this time period. Why does it take so long? You're probably thinking in your head. Because you're required to take the prerequisites. So you're required to take the pre-classes that you need to get into the RN program. Now, the average time people take is 2 years. Some of them take longer. And you have to have the best grades to get into RN program, especially in Connecticut, where RN programs are limited in space and programs. There's not that many RN programs in the state of Connecticut. Most of the RN program in the state of Connecticut are through the community colleges. So if there is 10 community colleges that has 75 seats, that's 750 seats, right? And you might have 2,000 people trying to become RNs, they're only going to pick the top. And when you go for your RN program, so you finish your prerequisites, you now have to take a TEAS exam, which is a TEAS exam, to get into that program. So you not only do you have to have the top grades, you now have to score really high on your TEAS exam to be in the top pick to get into a Connecticut RN program, okay? The other option, instead of going, since it's going to take 2 to 4 years to get in an RN program, your next option is just go straight for your BSN. So a BSN program requires you to have a high school diploma or a GED. So a high school diploma or a GED, or already have a RN license. So if you do not have your RN license and you're going straight for your BSN, you come straight from high school, register to a university, right? And they have a 4-year program, which is much better, right? Your BSN will take you 4 years. It won't take you any less. It won't take you any more. It will take you 4 years. Unless you're a slacker, then it might take you a little 6. Like some people take 6 years to accomplish any BSN. So I think, in the RN program, they're really strict, right? So it will take you 4 years, 4 years flat. So instead of going the RN program, which might take you 3 to 4 years, might as well you go in your BSN program, right? But the thing is, you have to get accepted into one. So once you get accepted into one, the first year, you're doing a prerequisites. All the prerequisites that they require within the first year. Then after that, second year, you start your pre-nursing program. And third year, you are finished with an RN. So if you want to go ahead and ask for permission from the school, you can go get your RN license. and start working while you finish your BSN. Okay? Some schools offer that option, some schools don't. You just have to wait till you graduate to get your BSN. Now, both RN and BSN, in the term that we're speaking, if you're doing it straight from high school, right, requires you to take the board. So you're required to take the NCLEX RN to be licensed to practice. So you can get your degree in nursing, but if you don't pass the boards, officially, you're not a nurse. Okay? So you can have a nursing degree, but it requires you to pass the state boards to become a nurse. Okay? Your job description is passing meds, doing care plan, managing the care plan for your patient, initiating IVs. The fun part, initiating IVs. For me, that's fun. For you, might not be fun. But initiating IV, overseeing LPNs, overseeing CNAs. So those are your jobs. You know, overall care of your patient is your responsibility. Advocating for your patient is your responsibility. You are the middleman between the doctor and your patient. Okay? You are the supervisor of the LPNs and the CNAs. You're there to make sure that they're accomplishing their task the right way. Okay, so you have a lot of responsibility as a RN or a BSN nurse. Now the average salary is $35.24. Okay, which yields you $73,300 a year. All right, so that's the average pay in this job description. Okay. Now, if you are already a RN with experience and you go for your BSN, so most hospitals want you to go for your BSN. Some hospital will hire you as a RN and let you know that within 2 to 3 months of being hired, you have to initiate a BSN program. And then they tell you you have 5 to 10 years to complete that BSN program. If you're still in their company after 10 years, some of them will let you go because you did not uphold your side of your contract of becoming a BSN within the 5 to 10 year 5 to 10 year time limit. Okay, they will let you go. So that's a part of the contract that they sign with you now. So what does becoming a BSN nurse does if you are RN? You can become a BSN nurse within 3 months if you're dedicated, or it can take up to 2 years. You have the, not even 2 years. Yeah, well, up to 2 years. Depends on how you go. So this is either part-time or full-time, right? Then once you become a BSN nurse, there's no boards for you to take. Yay. No state exam for you to take. You're a BSN nurse with experience. And what does that lead to for your nursing career? It leads to you being able to have more leadership position in your organization. Okay? So because you're a BSN nurse, they might make you a nurse manager, nurse leader. So that what the degree affords you, which might give you $1 or $2, depends on where you work, could be more on your pay, right? And that is why we want to become a BSN nurse, so that of course we can get paid more for the job that you do. After you become a BSN nurse, next thing you can do, if you're dedicated, you can continue to advance yourself by getting an advanced degree, right? Because nursing, once you're a nurse, there's not much advancement in nursing without a degree. Okay? So the more degrees you have and the more certificate you have is the more likely you're looked upon as a nurse leader and the farther you will go. If you don't take the initiative to learn new things and get certified in new things, and sometimes they'll pay for these classes for you, or you go out your way and pay for your own classes and get these certificate, then there's not much growth for you in nursing. You'll continue to stay bedside. Okay, if you do not like bedside, then there's different avenues that you can take. Okay, so you can come out of the hospital setting and do different things. There's a wide range of things you can do as a RN, as a BSN, all right? Besides going advanced. But then when you go advanced, the umbrella becomes much bigger for you. The bowl is huge for you, okay? So let's go into advanced. So as an advanced degree nurse, you can achieve your master's in nursing. So a master's alone in nursing would afford you the option of teaching. So with your degree, with your experience in the hospital setting, so a minimum 5 years experience that I've seen, you can then go into your colleges, you can go into your university, you can now become a teacher or in LPN programs, CNA programs, you can now teach. Okay, so you can teach other people to become nurses once you get your master's degree. Now, that only puts you up. So say BSN is here, master's here, okay? Now, along with your master's degree, you can specialize, okay? If you specialize, you're now up here, okay? So once you specialize, when you specialize in your master's degree, it gives you a title of advanced practice nurse, which is the APRN, okay, advanced practice nurse, or a nurse practitioner, which is a NP. And that is your master's with a specialty. A master's without a specialty just makes you a bedside nurse with a master's, and it allows you to teach. A master's with a specialty makes you an APRN, an advanced practice nurse, or a nurse practitioner, a NP, which is in some states almost very closely equivalent to a doctor. A little bit over a PA. In my mind, you're a little bit over PA and close to a doctor. So if a doctor is here, you're here, right? Like you're almost there. All right? In some states, you are kind of here, which is a problem. You can see there's a little bit high. So in some states, you can do what most doctors do. The only thing you cannot do is perform surgery. Okay? You cannot cut someone open and perform surgery. But you can write prescription. You can evaluate diseases. You can cure diseases. You can cure illnesses. You can take care of the whole patient by yourself in some states. Okay? So, master's degree with a specialty, and the top 4 specialties are, so if you're going for your master's, the top 4 specialties are family practice, psych, midwifery, and anesthetician. And what is the difference? So, family practice is a wide umbrella. You have a wide range of people that you can see. So, you can see from a family practice, you can see from newborn to elderly. Okay? So, you can see newborn to elderly. Okay? And within a family practice degree, you can specialize in the specialty. Okay? So you can specialize within this wide range of patients. So you can specialize in geriatric. You can specialize in women's health. You can specialize in pediatrics. So you can do a wide range in this family practice degree, right? So you're opened up a door for yourself, not a window with a family practice degree. Okay? You have a whole door to walk through, not a window. Okay? With a psych degree, you're only doing psych patients. So you're taking care of the whole entire psych patient, giving them their prescription, assessing them on a daily basis, evaluating whether or not the medication is working, if you should change the medication. So in a psych practice, you're only dealing with psych. There's a wide range of psych patient, yes, but you're only doing psych, okay? And that's your window for psych practice. So unlike family practice, you can do many different things with family practice. You can med spas, pediatrics, like I said, geriatrics, women's health, men's health. The range in family practice is wider. It's a bigger net to fish with in family practice in that sense. Then after midwife, you can become, after psych, you can become a midwife, right? Midwife deliver babies. So you're equivalent to the delivery part of a OBGYN. So you're there taking care of your patient and helping them deliver their baby safely into the world. You're also teaching them how to breastfeed and give care to their child. Okay? Then the top tier of your master's degree is a nurse anesthetician. A nurse anesthetician is the highest median paid nursing position there is. And a nurse anesthetician requires you to work at least 2 years in the ICU or the ED. Okay? So if you want to become a nurse anesthetician, you need to work in the ED or ICU or both to become a nurse anesthetician. Those are the only two paths in your nursing career you need to work. So any other floor will not get you into the anesthetician school. You need to work in ED or ICU, okay, to become a nurse anesthetician. And as a nurse anesthetician, you are somewhat equivalent, like I said, somewhat equivalent to an anesthesiologist. So basically, you're doing almost the same thing that they do. Okay? Just like how as an NP, you're right here underneath the doctor, you're right here as a nurse anesthetician. This is a nurse anesthetician. This is an anesthesiologist. You're right here. Okay? Which they need a lot more anesthesiologists or nurse esthetician in the world, in the United States. So it's the highest paying because it's the highest demand. Okay? So that's what you do with your master's. You have to specialize with your master's so that you are, you have a wider net to fish with. Now, after you've done that, in some states, you can open your own private practice with your master's. Okay? In some states, you can open your own private practice, you can open your own clinic, you can open your own urgent care. Like urgent care has been a big thing now, so you can open your own urgent care with your master's with a specialty. Okay? You can do all that stuff with your master's with your specialty. The average income, you're probably wondering. The average income is $55.67 an hour. This is your average income once you achieve a master's. That doesn't include your income as a specialty. So the average income for a master degree nurse is $55.67 an hour, which gives you $115,800 a year. This does not say that this is what you're gonna make. I know psych nurse practitioners make twice that. Okay? So this is just the average master's degree income. They didn't ask for specialties. They asked for the average master's degree income for that nurse. Okay? So this is the master's degree income. Now, once you become a master's nurse, you have the option to go even further and become a DNP. Okay? A doctor of nursing practice. So you have that option. In some states, it requires you to have a DNP in order to have your own private practice, just to let you know. So in some states, you have to look at your state, what the requirements are. But in some states, in order for you to have that urgent care or that private practice or that community clinic, you have to have your DNP. Okay? And the salary is $60.81 average median salary an hour, or $126,485. So that is the average salary, the median salary for a DNP. Now, yes, it is very low, especially if you're having your own practice. If you're having your own practice alone, the average practice makes at least, in the beginning, after 2 years of being open, once you're 2 years in and established, you're bringing in at least $500,000 a year. Okay? So keep that in mind. So these numbers are low, but your options are very high. Okay? So I hope that I went over everything. This is the levels of nursing. And I hope that the information I've given you is beneficial. It helps guide you, make nursing a little bit clearer to you, make you understand nursing more. Okay? I just want to point out, nursing is a technical job. Okay? So the more you learn is the more you get paid. The higher your degree in nursing is, the higher your pay is. You are not, well, I guess there is like miracle cases, but not the average nurse is bedside, and they will be bedside for 20, 30, 40 years, as long as their career is, okay? If you don't like bedside, you go and get your degree, and you move on like that. Now, let me tell you, your master's degree, I don't know if I had mentioned this. Master's degree can take you 8 months to 2 years. Depends on how you do your master's, okay? So you can do it online, find your own clinicals, or you can do it the traditional way where you actually go and sit in a classroom, and that can take up to 2 years, and they provide you your clinicals. When you achieve your master's, you still have to take a board exam. Okay? So be prepared to study for your board exam. All right? when you achieve your master's degree. So, master's, specialty, okay, master's, specialty, pick one, and then board exam. Depends on your state, you still have to get your DNP, okay? So, I hope this information, like I said, was helpful. I wish you luck in your nursing career. I wish you Godspeed, knowledge, strength, okay? And please, please, please do not forget to like, subscribe, and share my video. My goal is just to make this clear to you. It was not clear to me when I started in this nursing career. So I want to make sure that you do not make the mistakes I made. I want you to get into this nursing career 2 feet on the ground. Okay? Thank you for watching Nurse Life Happens, and have a God bless day.